Good evening, everybody, and welcome to RAMP, Real Access Motivates Progress live Wednesday night podcast. We thank you so much for choosing to watch our show tonight to learn about a brand new resource or organization that we have to bring to you. And tonight is unlike any other. We have a great organization called Carelink that we're going to be talking about tonight. So, welcome to the show. I am so excited to talk to the both of you tonight and let everybody in Rhode Island know all about Carelink and what it's all about. So, Kelly, why don't you tell everybody who you are and what you do?
Sure. Thanks to start, Tina, for having us. We're really excited to share about Carelink. So my name is Kelly Hurley. I am the coordinator for the ADPI grant that Carelink is currently running, which we're going to get into in a little bit. And I also started my career with Carelink as a physical therapist assistant working in many of the skilled nursing facilities that provide excellent rehab throughout the state.
That's awesome. Stephen, tell everybody who you are and what you do.
My name is Stephen Paul. I'm an occupational therapist. I've been practicing as an occupational therapist in Rhode Island. It'll be 25 years this August. So I've been around Rhode Island for a while. And I've been working at Carelink. It'll be 20 years this November this year. So I've been working at Carelink for a long time as an occupational therapist, and have been providing occupational therapy services at almost all of our facilities and sites that we provide therapies at. So that's what I do. And
that's amazing. And, we want to get right into it tonight. Everybody's like, Carelink, what is Carelink and why should it be important to them? Kelly, tell everybody a little bit of an overview of what Carelink is and what they offer.
Sure. So Carelink is a lot. So it's taken me a long time to kind of get the full gist of what we do. But Carelink is a nonprofit, mission-driven, comprehensive healthcare network of providers. We provide exceptional care to older adults and adults with intellectual and developmental disabilities wherever they call home. So we provide a continuum of care starting at the skilled nursing level, assisted living, and then all the way to outpatient rehab where we provide therapy as well. So we have been around for 25 years and we provide specialized healthcare services, mobile health care services with a wide range of different options such as mobile dentistry, podiatry, audiology, wellness, rehab. I'm sure I forgot something, but that is, we have a lot of different services, and our goal is to, like I said, meet people where they are. So provide the services where the people call home so that they, oftentimes it's difficult for someone to leave wherever they're living to go out into the community to get these services. So we like to be able to provide mobile healthcare where we can come to them. And this has been especially important coming out of the pandemic and in the pandemic where a lot of people were not accepting office visits or, people coming in and out of nursing facilities. So it's been really great that we've been able to continue to provide those much needed services.
Now, everybody knows why we are having this show tonight, because what you provide for all of us here in Rhode Island is essential. It's not a want, it's an absolute need. What you do, like you said, especially coming out of the pandemic, it's so important. And with our transportation issues, it's amazing that you come to us because, we can't get out a lot, or, transportation is so difficult for this community that it's amazing of what you do. Stephen, tell everybody where they can find Carelink or where their first interaction should be with Carelink and how they can, sign on.
Well, you can find Carelink in almost any part of Rhode Island. So I'll start where our office is in East Providence. You could always call the office at 401-490-7610. You can ask for Eric Franklin or Kelly, and you can ask what services you're interested in. They can point you in the right direction. We also, at that office in East Providence, provide outpatient therapy, speech language pathology, occupational therapy, and physical therapy. We have rehab teams right around the corner at Talkwauton on the Water. We have a rehab team at Steer House in Providence. We have a rehab team at St. Elizabeth Home in East Greenwich. Rehab team at St. Clair in Newport. They also provide short-term rehab as well as outpatient therapy as well. Did I forget any, Kelly? Can you think of any that I forgot?
Yeah, it's St. Antoine's up in
That's
North
right, St.
Smithfield.
Antoine's. How can I forget St. Antoine's? They also have outpatient as well as short-term rehab at St. Antoine's.
I was just about to say that because that's up in my neck of the woods.
Right.
I think Stephen forgot about it because it's so far away.
That's
I feel like I'm in the
Everybody
hot
forgets-
seat, so I can't
Everybody
remember.
forgets our neck of the woods, but that's okay.
know.
I don't, because I meet a lot of people there, you know, to go to your rehab, and you know that's where I first encountered Carelink over there, and got involved, and then met the wonderful Christine Gabois, who everybody in the state knows, because if I'm not everywhere, she is. You know, it's you know, we kind of tag team each other wherever we happen to be at. But Stephen, you've been almost with Carelink from the beginning, since you've been doing it and been around for 25 years. Were you around when Carelink started 25 years ago?
Well, I started working for Carelink in 2003, so November of 2003. So it was started in 1997. So, you know, I wasn't really aware of Carelink at that time, but had kind of, because we have St. Elizabeth Home. I live in East Greenwich, and was looking for some part-time work, and that's kind of how I got introduced, which later turned into a full-time position that I applied for. So I actually worked for Carelink prior to 2003, but as a per diem part-time capacity. So that's how I found out about them. And you know, what I really liked about Carelink was the nonprofit approach, and how they really embraced the rehab process. Was, you know, our focus is encouraged to be on the clinical side. So as a therapist, that was really important to me. It wasn't all about,
you know, I was just going
productivity
to
and
ask that.
documentation. Yeah.
I was just going to ask you that, or how the nonprofit side, because I think it works out better. A lot of when you go to a nonprofit model, people seem to get better care for whatever reason. But I was going to ask you, so thank you. You jumped the gun. You're in my mind. It's a scary place in there, but I'm glad you're with us. But you know,
I must say to all my colleagues that practice as therapists, we're all highly trained, no matter what setting we work in. I think
that is
occupational
amazing.
therapists,
Carelink
physical
is everywhere.
therapists, yeah, and speech language pathologists, we all do, you know, really good work.
Yeah, you guys are amazing. But I hear congratulations are in order to you both, because you just got $1 million grant to do some really wonderful work. Kelly, why don't you cover what that grant entails and what that's going to mean for your patients for Carelink?
Sure. So as part of our outpatient rehabilitation program at Carelink, we applied for a really significant, as you mentioned, close to $1 million grant through the ACL, which is the Administration for Community Living, which is a branch of the federal government. And we received that funding, which is massive. And so that funding is to provide some home-based, some evidence-based programs for people living in the community with some sort of cognitive impairment, dementia, Alzheimer's, that whole kind of umbrella. And so the grant is pretty hefty. So we trained, we have occupational therapists and speech therapists that are working under our grant. Right now we have a team of 5 and hiring more. So we are, you know, growing rapidly, and we trained our clinicians in 2 different evidence-based interventions. So they will go into the homes of people in the community. They will sit down with the families. They will, you know, listen to their stories, because a lot of times, you know, everybody has a story, and a lot of times, you know, that life comes at you fast. When you get a dementia diagnosis, I mean, with any life-changing diagnosis, these family members really don't know where to turn. So to be able to be that person to sit there and to sometimes even hold their hands and say, listen, we hear you, we know what's going on. You know, we can provide you support. We can provide some some treatment for your loved one, but we could also provide some treatment and some support for you, because we know how important it is as a caregiver to support you through this journey, because it's really, really, it's really challenging for all the people involved. So it's an amazing program, and it's all offered no out-of-pocket cost, which is like, I can't find anything in the world that's free these days. So, you know, to be able to offer that to the community in Rhode Island, we feel really, really lucky to have this program and to be able to share it. So
That's amazing. Stephen, as an occupational therapist, you must get the whole hand holding part, and you must hear some whoppers of stories. And it amazes me how much information, when you actually sit down with a person and let them just talk to you, the information that they will give out to you. So it takes a very special people to sit there and listen to those stories, because they can go on. Stephen, I hear your niche is in the IDD part of all of this. Tell us a little bit about that.
So something to know about dementia is, one is it's a worldwide issue. They estimate about 55 million people around the world have dementia, with a disease that contributes to dementia. Dementia is caused by a disease process. So like Alzheimer's or Lewy body dementia or vascular dementia would be examples of that. And studies have shown that 1 in 10 Americans have dementia, so it affects everyone across the board. And with the IDD population, it's the rate of occurrence is actually pretty high. If you take all those numbers, they are a big part of that. So you know, with Chris's kind of leadership, and Carelink has been branching out and providing therapy services to that, we thought it was probably, you know, a good idea to also provide these services to the IDD population. Right now, I'm in the process of doing some training, credentialing with Jefferson University for my skills to care credentialing, which I'm credentialed in skills to care as an occupational therapist, but they're doing a pilot program for people with the ID population. So there's a group of occupational therapists from Pennsylvania and some one from Florida, where there's 6 of us that are doing this training to kind of spearhead it and kind of figure out how we can provide services to that population. People in the ID population have a much higher rate. So, you know, just if you take people with Down syndrome, 65 and older, they have a 75% rate of occurrence of dementia, which is a pretty significant number. And then just the general people with intellectual disabilities, they estimate, you know, that's like 3 or 4 times more prevalent in that population than it is in the general population. So I think the important thing is that dementia, it can affect everyone. And then when you think of the IDD population and the needs that they have, providing them care is really, you know, it feels good to help people, but it's I think when I work with all my clients, whether they have IDD or not, it's very rewarding, and it's great to see people, you know, making progress and making the quality of life better. I think that's the most important piece, is improving a person's quality of life.
And I applaud you, because most places will not reach out to the disability or the IDD community when they get grants like this. They take care of, but I mean, I remember, you know, not too long ago when we were thinking Down syndrome individuals wouldn't be making it to 65, and now we have a stat that 75% of them could, you know, so just even knowing that they made it to that threshold, that we're still taking care of them after the fact, is huge. That we're making progress, that we're correcting wrongs, and we're taking care of the populations that nobody thinks about. So I applaud you both on, you know, making that a priority as part of this grant, because a lot of people leave that out.
And I think, you know, people, whether you have an IDD diagnosis or not, and you have dementia, or you're living with someone that has dementia, it can impact everybody. So, you know, the skills to care really focuses on the care provider, because there's some evidence to suggest, you know, that care provider's health and well-being has a direct effect on the person living with dementia. So that's an important piece to uplift, is that of those 55 million people around the world, and of those 1 in 10 Americans here, there are care providers that are providing care for them, and their lives are impacted as well, and not just the person living with dementia. So that's an important thing to keep in mind.
Yeah, I mean, if you ever lived with somebody or took care of anybody with dementia, that wears on you as a person, because you lose them time and time again, every time that they remember you and forget you again, or you know what I mean, they're going through it. So it's, again, I applaud you again for taking care of the people who are taking care of them, because it's such a hard job. You don't want to give it up, but knowing that you can get a break, or knowing that there's support's there for you to get a break is so important. Kelly, tell a little bit more about how you take care of the caregivers, because again, that is so important.
Yeah, I'm glad you brought that up, because I did want to touch on one of our interventions, which Stephen had mentioned, is called Skills to Care. And that is an evidence-based program that is offered by Jefferson University, which is in Pennsylvania somewhere,
Yes.
Stephen? Yeah.
Yep.
And so that program is designed to support the caregiver of the person with dementia, as well as the person with dementia. So there's nothing really else like that, at least in Rhode Island, a program that really looks at the person and the family and the caregiving, you know, as a unit, and treats both of them rather than just the person living with dementia. So Stephen's certification includes a lot of training and a lot of supervision, and a 6-month kind of period of back and forth, because it is such a personal, really, you know, like I said, you're entering the home of someone that really truly is in crisis. They're grieving, and Tina, as you mentioned, the diagnosis of dementia or Alzheimer's is not, you know, similar to some other diagnosis, but it's not a quick disease process. It's 5, 10, 15 years of constant everyday kind of forgetting and losing your loved one again and again and again, and family members. I mean, it's so difficult and so emotionally and physically draining as they, you know, start to lose mobility, along with their memory and their communication. So Skills to Care works on focusing on a target area. So whether, you know, they call it kind of behaviors that manifest through dementia. So whether it's, you know, difficulties managing medications, or difficulty with, you know, communication. We used to have these great conversations, and now, you know, everything she says, I'm like snapping at, and we're fighting all the time, and, you know, working on that sort of a thing. Sometimes it's toileting and continence. That's a huge problem as dementia progresses. So all these different problem areas or target areas, the clinician will sit down with the family and problem solve them together. Have you thought about this? What if you tried this? Maybe, you know, and come up with a plan. And they pretty much leave them with a little bit of homework and say, try these strategies, see how it goes, see if it gets any better. And then they touch base again the next week, sit down with them, hear them out. You know, it's, you know, occupational therapy is a funny word for what they're doing, because I think therapy is really the key point of that, because it really is sitting down with the family and listening. You know, and providing that really, you know, you're a therapist in many aspects of therapy, Stephen. So that's important.
Yeah, I think it's funny, because anything that you put with therapy in it, therapy is the main one. So I don't understand why they don't put therapist occupational, because therapist is always first, no matter what you put with it. Therapist is always first. You know,
Right.
Stephen, tell everybody, she was telling us that you do a lot of training, and you're hiring and you're growing. Tell everybody how they can contact you if this is a field, or this is a place that they want to get involved in, and they want to help out and they want to work at. How do they go about, you know, getting in touch with Carelink, or what do they have to do to go through the process?
As a therapist?
Yeah, like if they wanted
Yeah.
to come on and work with you, and you know,
Yep.
go through the training.
So, yeah, they would call our office. They would call Eric Franklin. He's our director of our rehab department, or Sandra Fournier. She is the executive director as well, of some clinical services. So you could contact either of those, or reach out to Kelly at the number that I gave earlier. If you have questions about therapy or coming on board and working in therapy, I have a work email. It's spaul@carelinkri.org too. You could always reach out to me that way, and I can try and direct you to the right person as well.
And do you highly recommend people coming on board, or at least checking it out?
Yeah, I think, if people want to come on board and work, I mean, the first is, if you want to work as a therapist, have your credentials in order, your registration and your Rhode Island license to practice. Right now, we're not providing any services in Massachusetts. So if you're out of state, you would have to pursue getting a license in Rhode Island to practice either occupational therapy or speech language pathology for our grant program. But we do have positions in all areas for therapy, trying to find therapists, physical therapists, occupational therapists, and speech language pathologists, especially since the pandemic has been challenging to staff all of our places that we provide services has been challenging. So
basically what he's telling you, if you need a job and this is something in your alley, apply. We need you. There is a huge community out there. I mean, think about it. The 55 million people that he was saying, that have dementia, but think of our population that is 60 and older. Over 50% of Rhode Island's population is 60 and older, and that's growing by 2030. The 26% of the population that is disability, you put all those percentages together and you'll be set for life in a job that will be so rewarding, helping people do the right thing and helping their caregivers, get on track. What a rewarding job this would be for you. So reach out. And if you don't remember any of the phone numbers you give, reach out to me and I will put you in contact with them, because I work with them constantly. So, all know how to get in touch with me. So just reach out and I will, pass along the information. But we need you. We need your therapist. The world needs you. Rhode Island needs you. So step up to the plate and have a lifelong rewarding job. Stephen's been there, almost from the beginning of Carelink, and it doesn't seem like he's going anywhere anytime soon. So
he better not.
we
Kelly,
have a great
God,
we have a great rehab crew at Carelink, so it's a great place to work.
Yeah, and like I said, it's a rewarding job. Like, who can say that they're going to work to change the lives of others, like on a daily basis? That to me is like one of the most rewarding things that you can do. Yes, it's going to get aggravating at times. Every job is, but in the end of the day, what a rewarding thing to help the lives of others, to do what you already love doing, because you already have your licenses and everything to do what you love to do. Kelly, tell us a little bit more of, what Carelink does and where else people can find resources for them.
Sure. And I think Stephen has talked a lot about our rehab services, which is obviously he's worked for 20 years in that program. But I think it's important, a few things to note, that Carelink specializes in this population of older adults. And I think in Rhode Island, any of the kind of outpatient therapy clinics or therapy clinics that you might walk into, you would find, a teenager on the treadmill, and then maybe a guy with a knee replacement on the table, and, a whole wide range of ages. And I think that the fact that Carelink specializes in that older adult population, it really puts us at the forefront of, all these different evidence-based programs that we can provide. Our fall prevention wellness programs that we have are, like I said, are really specialized rehab. I have a bunch of our clinicians are certified in the LSVT LOUD program, which is for people with Parkinson's disease. And that's an evidence-based program, which is really great. So all those little specialized, it's a small niche that Rhode Island has, or that Carelink has in Rhode Island, but I think we're really the only people that are hitting that population. And it's so important to have therapists that know how to treat you at your age, at your level, wherever you are, your needs. I think it's really important to touch on that. These are experts at that. A lot of clinicians treat the whole spectrum of ages, and we're really specialized there. So that's important. And then the other services we provide. So we're in over 100 nursing homes in the state, nursing homes and assisted livings, providing our mobile podiatry. So our podiatrists go in and into the nursing homes, into the assisted livings with their little tools, and they provide their podiatry services right where the people are. Same with dental, they'll go in, they do mobile x-rays right in the patient's room if necessary. You know, a lot of our patients that need dental care might not be able to get out of the building, so we come to them. That we have hygienists do regular cleanings throughout the state, which is amazing. And you know, our audiology program will have our audiologists go into different group homes and different nursing homes and other facilities and do hearing tests and prescribe hearing aids and get hearing aids fitted. So that's a huge program. So all of our mobile healthcare programs and services are exceptional. And you know, like I said, throughout the state we're in, I'm sure that if you've ever been in a nursing home or an assisted living in the state, or even gone to visit someone, you probably stumbled upon one of our staff members, because we have a really big staff and we seem to be everywhere. So
yeah, you may not know that they're from Carelink, but they are. Carelink is exceptional. And, you know, I love the point that you made that, you know, when somebody specializes in something, it makes it that much better. You know, when you are only dealing with this population, you're learning the ins and outs, you're learning all of the scenarios that could happen, you're learning, you know, everything that could possibly go wrong, and you have a niche. You know, like we have Hasbro Hospital for our younger kids. You know, Carelink is taking care of our older population. You know, it should be just as boisterous, it should be just as well known, and that's exactly what we're hoping to do today, to make sure that people know that these services are out there, that Carelink is there and they are ready to take care of you, and you can work with amazing people like Kelly and Stephen. Stephen, what have you noticed over the years that's changed because that is such a niche for Carelink?
But you mean what has changed at Carelink or in the state?
No, change with, you know, like the occupational therapist and what you've known and what you've pivoted to, knowing what you know and knowing that this is like your field.
And I mean, there's been a lot of changes. I think, you know, the biggest change that I've seen is recent change from the pandemic on how we deliver services. And, you know, there was always a big focus on short-term rehab and getting rehab, but I'm seeing more, I feel like things have changed in that our services are growing in the outpatient realm, like what we do in the dementia program. And the need for people reaching out for services has increased in that area. So I would say that's been the biggest change that I've seen, is how we're delivering services to our elder population. You know, as Carelink has grown, we've branched out to more areas of the state beyond the kind of skilled nursing facility kind of realm, and, you know, working on getting our credentials to provide outpatient services at different sites, because those sites, some of our sites that we provide outpatient is also open to the community. So it doesn't mean that you can't get the rehab services that you would get at another outpatient facility. You can get them there like at St. Clair or at our office in East Providence. So that's kind of, I think, the biggest change that I've seen.
Yeah, and you know, I love that you said that, because a lot of people, you know, we were told for so many years, especially the disability community, you can't go to work from home, you can't go to meetings from home, you can't go to school from home, and that all happened within a month's time. But when the world started coming back and the doctors were still doing virtual appointments, well, virtual is okay, but nothing is better than hands-on. Nothing is better than actually seeing. I mean, I could lie to my doctor when I'm virtual and say this, that, and the other thing, or you really can't get the in-person feel that you need. And I, again, applaud Carelink, because I'm such a fan of Carelink. You don't do the virtual, you do the actual in-person. You actually go out and meet them where they are. And that is huge, because like I said, the video is okay. And, you know, everybody thinks that that should be the only way. It's not. You need the hands-on, you need the in-person, you need to be reading the room and reading the person and being them. So I love the fact that, you know, Carelink pivoted to doing more outpatient and meeting the patient where they are. How has the response to that been, Kelly?
I think it's been great. I do think that at the beginning with outpatient coming out of the pandemic, I still think there was so much hesitation. I mean, me personally, I think people were really afraid to leave the house, and so to be able to come to a place like Carelink where and I kind of mentioned this before, but you're not going to have 15 or 20 different patients in the gym at once. It's a really personalized one-on-one treatment session where it's you and your clinician, and they're really working directly with you. And that personalized one-on-one care that we can provide is really important. And I think it puts people at ease, especially like we were talking about coming out of the pandemic, where being in, a facility where there's a lot of people in the same place, maybe people are a little more hesitant. But yeah, I mean, we've thrown around the idea of trying to introduce some virtual services out of convenience for our patients. And our clinicians, Stephen included, have really fought saying, it's so important for us to be able to put our hands on these people. So, it's so important for us to be there in the room with them so that we can interact. And these folks are of the generation of being together. They're not the younger generation that FaceTimes and Zooms and TikToks and whatever they're doing. They're used to being together, and so that camaraderie and that importance of bringing people together and being in the same room and providing that comfort, it's so important, and we have really pushed that for sure.
Yeah. I do find it funny though, more and more older people are on TikTok.
Oh my God, I know.
On Facebook and Instagram, I get a kick out of it because they're funny. You know what I mean? It's raw, it's them, it's who it is. There are some spaces, don't get me wrong, for Zoom, like when you're doing a group meeting, or you know what I mean, where people don't all want to travel in, but when you're doing occupation, like, you need to be in the room, you need to be with that person. It's just so important. And I just think the personal touch, this life and this world that we're in, we're losing the personal touch. People are in the same room texting each other from across the room. We're losing that personal touch, where I applaud you for keeping it real, keeping it going, and giving them, the personal touch that they absolutely, especially when you're talking about Alzheimer's and dementia. It helps them when somebody's in the room. It makes it more real. It's not, I'll tell you, I remember going through all of those Zoom meetings one-on-one and going, how many meetings did I sit on today? Was that, you know what I mean? Like, you get lost, you get confused, and you don't remember who you talked to or who you met. That is incredible. Stephen, you work with people of all abilities, correct?
Yes. Yep.
Yeah.
I mean,
of
dementia.
all ages of abilities of disability, or just elders of disability?
Well, I mean, I work with elders with dementia, but yes, I have worked in the past with other populations, with adults and in pediatrics, prior to working with Carelink. So I've had that experience in the past.
Yeah, but does a person with disabilities, I'm asking because I really don't know the answer, do they just do the elder population, or do they do the elder population and people of disability?
No, yeah, we can do elder population with disabilities.
No, but
For
what do
sure.
you do younger if they have a disability? Just if
Yeah, I
they
would
have a
say,
disability.
yeah, I mean, yeah, I don't think that we're limited to that. I mean, just because our specialty is elder care, our outpatient sites could provide services, outpatient services to younger people.
Yeah, we provide some rehab services in some of the group homes throughout the state, as well as adult day programs or day programs that I think one of the big day programs that we do services in has all ages, right, Stephen? Not pediatrics, but
Right. Yep.
adults.
They do.
Through.
They have
so,
all
yeah.
ages. And
Yep.
And I think in that population, the ID population, the onset is at an earlier age. So you might see people presenting with dementia signs in their late 40s or even in their 50s. So the onset is usually a little bit sooner. So those people are still quite young. So to be experiencing that.
Yeah, I mean, that's incredible because I know most of the state has pivoted where it's aging, but yet if you have a disability, you're part of the population and can get those services because we can't get them anywhere else. So, that's a great thing that CareLink is dabbling in both, especially going out into the group homes and making sure that you get an earlier check so Now, how does somebody know if their loved one is starting with dementia within the IDD population?
It's
Stephen.
such a good, sorry, I'm not
Kelly, go ahead.
Stephen. No, I was going to say it's such a good question because it's something that is known to be very tricky because when you're looking at an adult that is showing signs of dementia, you're looking at the symptoms of dementia, right? And then when you're looking at someone with IDD that is showing some changes, you have, their IDD manifestation, and maybe that is progressing. And then you have whatever cognitive change that you're noticing. And it's really important, Stephen can talk about this a little bit, but to rule out that there's nothing underlying going on, especially in that population where sometimes they can't communicate, and you want to rule out, are they having an infection? Is it a UTI? Is it, are they, God forbid, having a slow bleed or some sort of a stroke that's causing these cognitive changes? So the early identification in this population, more than any other one, is so important because there's a lot of things to rule out before you jump to dementia. And Stephen, I'm sure you have a little bit about that too.
So, I mean, I'll start kind of in general and kind of narrow it down to answer the question. So first, we know that dementia is not a normal part of aging. So that's a big myth that I felt like would be important to mention. So I figured this would be a good time to kind of plug that in. And it's not just about memory loss. That is something that you'll see someone with dementia. But it's about, you might see personality changes, you might see behavior changes, you might see changes in how they speak and how they can find words or use words. With the disability or the ID population, the changes that you see sometimes aren't always the same as in the general population. You might see changes in their ability to do their ADLs sooner. That usually a decline in their activities of daily living we usually see in the later stages of cognitive impairment that's caused by dementia. People with intellectual disabilities might present a little differently. They might start having trouble with being able to manage their bathing and dressing and toileting. And they might kind of, you will see kind of also a disinterest. They kind of just become kind of a malaise, kind of just not really interested in doing things. I've noticed in the short time that I've worked with this population with dementia too, I see changes in their functional mobility, their ability to walk and move their bodies in the environment. It becomes more difficult. So those are some of the changes that I've seen, experienced.
It's so hard because I know myself, going through the gamut that I did, from the cancer to the strokes to the heart attacks to being paralyzed. You never know when something pops up, which one of those it's going to, so I could just imagine what it's like in the IDD with the Alzheimer's or the dementia going through. When do you think a parent, like if it was a parent taking care of somebody or, somebody, when should they start asking the questions, or when should they, at what point should they reach out to CareLink to have them evaluated?
I would suggest, if you have a concern, just start with their primary care physician is probably the best place to start and have the discussions and voice the concerns. And, really kind of go with the guidance from your primary care physician. And then you can decide where you're going to go to branch out. Like Kelly said, a lot of times they want to rule out medically that there's something going on. Dementia can only be diagnosed by a doctor. So there's a process that has to go, a person may have to go through testing. It depends on, as they go through the process of evaluating it, they may add on diagnostic testing to, further kind of determine the exact cause of the dementia. So I would encourage people, if you to establish a good rapport with your primary care physician, and then, start with your primary care physician and tell them the changes that you're seeing. And what's amazing is that these care providers that have been providing care for these, for their loved ones for years, they know when something's not right or something's going on. And it's more than just them getting older. They'll say, yeah, but their personality is not the same, or this was something they love to do, and now they just, they don't want to help out around the house, and that was something they love to do. So those are the things, the little things that you might see early on. They are doing studies now with, across the board. A lot of times, there's a lot of studies with what I call or sometimes it is termed as the big three senses: smell, hearing, and eyesight. So sometimes if you see those changes, those are important things to also have checked out. So stay up to date with your eye doctor, stay up to date with your dental, with your primary care physician for your annual visits, and have your hearing checked if you're having trouble, because sometimes it could just be a hearing loss. And so those are the important things to check out.
Yeah. It's amazing. Carelink does so many amazing things. And like I said, I am so glad that we got to highlight, most of the services that Carelink does, because Rhode Island wouldn't be the same without you. And we can't wait to help you grow even farther. Now that we're nearing the end of the hour, Kelly, here is your 1-minute pitch of why everybody should get involved, donate, support in any way possible to Carelink. What is your, actually, I promised you I'd let you go last. So Stephen, what is your 1-minute pitch?
No. Well, I mean, I think the best way you can get involved is just, reach out to us. If, don't be afraid to ask for help if you feel like you need help, especially care providers that are living with people with dementia. Don't try the journey alone. There are supports out there for you. And there are people there that can help you. And, Rhode Island has its challenges with finding doctors and neurologists, but we can help navigate that. So don't be a hero. Try and reach out and reach out to us and see if we can help you. I think
that's great.
It'll make things better for you.
Yeah. All right, Kelly, you're up.
All right, I'll touch on the whole Carelink. I think I'm really proud to work for a company, a nonprofit company with a really great mission to serve older adults in the community and where they live. If you have needs, we will find a way to treat them. So, it's really great to have Carelink available with our specialties and all of our different services. So hopefully you all are a little bit more familiar with what we do, and I'm sure that you will see us, and if not, seek us out, find us online, call us, visit us, whatever you want to do. We are around. We're throughout the state.
And I said everybody to you. So if they don't know about you and they know me, I send them to you because some of my great friends and cohorts work there. And I'm so proud of everything that Carelink does. And I am one of your biggest champions to spread all the amazing things that you do. So thank you both for taking the time tonight and telling everybody a little bit more about what Carelink does. And I'll be sending a lot of patients your way to making sure that you can take care of every Rhode Islander out there at some point in their life. So thank you so much for joining us tonight.
Thank you, Tina.
Thank you so much.
And as always, I invite everybody to come back here, same time, same channel, next Wednesday night. We are talking to the Rhode Island Free Clinic next Wednesday night. So next Wednesday at 7 p.m., we'll see you all back here. And as I always say, don't just sit there, make a difference. Have a great week, everybody.